Welcome to the deep dive. Ever wondered what happens when an animal breaks its jaw? It's probably a bit more involved than you might think.
Oh, absolutely.
Today, we're taking a close look at fractures of the upper and lower jaws, the maxillae and mandibles in animals. And this isn't just about, like, a simple cracked bone.
No, not at all. It's a whole system, really. You've got muscles involved, the teeth are critical, and how it all functions together.
Exactly. And our main source today, it's a really comprehensive overview of these kinds of injuries.
Yeah, it gives us a fantastic foundation, sort of a detailed blueprint for understanding the complexities involved when a jaw actually fractures.
Precisely. So our goal in this deep dive is to really unpack the critical aspects of these fractures for you. We want to get into the common causes, the surprisingly detailed ways these injuries get classified, and the general strategies for treatment. Our mission is basically to give you a clear, digestible picture of this whole area, whether you're, deeply involved in animal care or just curious about how the animal body works. So where do we even start with something this complex?
Well, what's fascinating right off the bat is just how specifically these fractures are categorized.
Yeah.
It's not just a generic broken jaw.
Right.
There's a real system to it. And understanding that system is, well, it's key to treating them effectively.
Okay. It seems like location is the first big piece of the puzzle then. Our source mentions this A through J classification. Can you give us a feel for how that maps out on the jaw?
Sure. Think of it like dividing the jaw into different zones almost. So category A, that covers the very front, right around the incisors and the canine teeth.
Okay.
And interestingly, the symphysis, that's the spot right in the middle where the lower jaw halves meet. That's a really common fracture spot in cats, and it falls into this zone. Then B moves us just slightly back, sort of from the canine to the second premolar. C takes in the area from that second premolar back to the first molar, that big chewing tooth, the carnassial.
Gotcha. The main grinder.
Exactly. Then moving further back, D covers the body of the mandible leading up to the angle. E is specifically the angle itself. F is the coronoid process, which is a bony projection.
Right.
And G is the condylar process, which is actually part of the jaw joint, the TMJ.
Wow, that's quite detailed. But it doesn't stop there, does it? We've also got classifications for the roof of the mouth, the palate.
Exactly right. H deals with fractures running right down the midline of the palate. It covers those that are off to one side, non-midline.
Okay.
And then J is sort of a catch-all category for really extensive or multiple fractures, often the most challenging ones to deal with.
So knowing exactly where the fracture is, that's step one. But it's not just about the where, right? Severity also plays a big role in how these are classified.
Absolutely. Yes, severity looks at things like, does the fracture line involve any teeth? Are there tears in the gums, or are there soft tissues nearby? And even the nature of the break itself. Is it a clean crack, or is the bone shattered into lots of little pieces? That's what we call a comminuted fracture.
Now, this next bit is really interesting, how the animal's own muscles can affect the fracture. This idea of favorable versus non-favorable fractures. Can you break that down?
Yeah, this is where biomechanics gets really cool. The chewing muscles, they can actually have a huge impact on how a fracture behaves after it happens.
Yeah.
A favorable fracture is one where the natural pull of these muscles, like the digastric muscle that helps open the mouth, actually tends to nudge the broken pieces back towards alignment, or at least doesn't pull them further apart.
So the muscles are kind of helping out.
Kind of, yeah.
Yeah.
Unintentionally helping stabilize it, you could say. And this principle, it's not just jaws. It applies to other bone breaks, too.
Okay, so in a favorable situation, the body's own mechanics are sort of working with you. And a non-favorable fracture is when those same muscle forces work against you.
Precisely. In a non-favorable break,
Yeah.
the muscle action tends to pull the broken bits away from each other. That makes it harder to get them back into the right spot and keep them stable.
Right?
Understanding that difference is, well, it's vital for picking the right treatment.
That makes total sense. The source also digs deeper into those symphyseal injuries, the ones at the front of the lower jaw, common in cats, you said. Turns out there are different types even there.
Yes, exactly. We generally see three main types. Type I is just a straightforward separation, no damage to the soft tissues around it.
Okay.
Type 2 involves the separation, but with a tear in those soft tissues. And type 3 is more complex. You've got the separation, the soft tissue damage, and fragmentation of the bone, that comminution we talked about. And you often see broken teeth involved in those more severe type 3 injuries.
And it's really interesting the source points out that A little bit of wiggle or laxity in that symphysis can actually be normal in older cats and some small dog breeds.
Yeah.
It's not always a sign of a fresh injury. That seems like a crucial distinction to make during an exam, right? To avoid unnecessary treatment.
Absolutely crucial. Knowing what's normal versus what's pathology is fundamental for diagnosis.
Yeah.
Okay, so we've got a handle on how they're classified. Now, what about why they happen? The source is pretty clear on the main culprits.
Right. Injury and trauma seem to be the big ones, aren't they? Like a fall, maybe a dog fight, getting hit by a car. Sadly, lots of ways an animal can hurt its jaw.
Exactly. But, beyond those immediate traumatic events, there are also underlying risk factors that can make an animal more prone to these fractures, or maybe influence how bad they are.
Like what?
Well, for instance, animals in high-risk environments, maybe ones that roam, or those with, let's say, particularly adventurous temperaments, might just be more likely to encounter trauma.
That makes sense. An outdoor cat or a dog that gets into scraps, what other factors are highlighted?
Oral infections are a big one. Things like severe gum disease, periodontal disease, or bone infections like osteomyelitis can actually weaken the jawbone itself,
Wow.
making it more likely to break even from a relatively minor impact. Similarly, neoplasia tumors in the jaw can compromise its structure.
Okay.
And certain metabolic diseases like hypoparathyroidism, which messes with calcium levels, can weaken bones. And we shouldn't forget congenital or hereditary factors that might just mean the jawbone is naturally weaker or formed abnormally.
So it's not always a sudden big hit. Sometimes there are underlying issues making the bone fragile. Okay, so let's say an animal has potentially fractured its jaw. What are the telltale signs an owner or a vet might pick up on?
Well, the signs can vary quite a bit, depends on the specifics, but a key one is often a visible facial deformity. You might see swelling or the face just looks crooked.
Right.
Malocclusion, where the bite doesn't line up properly, the teeth don't meet right. That's another really common sign.
Okay.
You might see fractured or loose teeth, maybe some bleeding from the mouth or even the nose. And pretty obviously, the animal might struggle or just be unable to close its jaw properly.
And I guess the animal would probably be in pain, maybe unwilling to eat or groom itself?
Absolutely. Pain is a huge factor. Although sometimes animals are masters at hiding it, difficulty eating or just refusing food altogether is a very common way it presents. It's important to remember, though, some signs can be subtle, especially with less severe fractures, which really highlights why a thorough vet exam is so important.
Which brings us neatly to diagnosis. The source really emphasizes the need for a comprehensive physical exam. Why is that so critical here?
Because trauma, it really happens in isolation, right? An animal with a jaw fracture might have other injuries that aren't immediately obvious, maybe head trauma, other soft tissue damage, even internal injuries.
Oh, okay.
So a thorough physical helps catch those concurrent problems, which can definitely influence the treatment plan and the overall outlook.
Makes sense. Beyond the hands-on exam, what are the key diagnostic tools vets use?
Well, direct visualization, just looking carefully and gentle palpation, feeling the jaw, are important first steps. You might see obvious breaks, misaligned teeth, soft tissue tears. Feeling might reveal instability or maybe crepitus, that kind of crunchy feeling.
Right.
But the real workhorse for diagnosis is imaging. Radiographs X-rays are essential. Both the standard ones taken from outside the mouth and special intraoral ones taken inside. They let you clearly see the fracture lines, how bad they are.
Okay.
For more complex cases, things like CT scans or even MRI can give incredible detail, especially if you need to see soft tissues better or if the fracture's in a tricky spot to X-ray.
And the source also mentions considering other possibilities, the differential diagnoses. What else might look like a jaw fracture?
Yeah, it's important to rule out other things that could cause similar signs, like problems with the jaw joint, the TMJ, can cause pain and trouble moving the jaw.
Right.
Issues with teeth themselves, a loose tooth, what we call subluxation, or one completely knocked out of place. Luxation can affect the bite. A tooth root abscess can cause massive swelling and pain. You also have to think about things like foreign objects stuck somewhere, nerve damage, certain inflammatory muscle diseases, and even a specific bone growth issue in young dogs called craniomandibular osteopathy.
So it's a process of elimination, really.
Yeah.
Carefully ruling things out. Once a jaw fracture is confirmed, what are we looking at for treatment? It sounds like there's quite a spectrum.
There really is. Treatment is super individualized. It depends on the exact fracture, the animal's age, its overall health, even what the owner can manage in terms of aftercare.
Right.
But our source highlights 4 sort of key surgical goals that guide the planning. First, you want to reduce the fracture, basically. Get the broken pieces back into reasonable alignment. Second, restore the natural bite, the occlusion. Make sure the teeth fit together right. Third, provide enough stability for the bone to heal properly. And fourth, address situations where, well, repair just isn't feasible, which might need more drastic steps.
Okay. And based on those goals, there are different types of treatment depending on the fracture location, right?
Yeah.
Let's start with interarch stabilization. What kind of fractures usually get this?
Interarch stabilization, basically connecting the upper and lower jaws together, is often used for fractures more towards the back of the jaw. So those categories D through G we mentioned, and some of the complex J fractures too.
And how do they do that?
Techniques can range from something as simple as a temporary tape muzzle in certain cases, believe it or not.
Really?
Yeah, sometimes. To more involved things like cross-arch wiring, where wires are carefully placed between teeth on the upper and lower jaws. We can also use dental bonding agents, sometimes with little pins in the teeth for extra grip, to create a rigid connection. The source also mentioned some more specialized things like the beard device, bignathic encircling and retaining device, and cross-arch buttons for really tough cases.
And what about intra-arch stabilization? When's that used?
Intra-arch stabilization focuses on fixing a fracture just within one arch, either the upper jaw or the lower jaw. This is common for palate fractures, those H&I categories.
Right.
Techniques here often involve using pins and wires placed directly into the bone, various dental wiring methods, or applying acrylic or composite splints that are bonded right onto the teeth within that affected arch.
Splints seem to pop up a lot. There's also intraoral stabilization with splints, which sounds like it covers a wider range of fractures.
That's right. Composite or acrylic splints bonded to the teeth are pretty versatile. They can be used for fractures at the front of the mouth, classes A through C, those palate fractures, H and I, and even some of the complex J fractures.
Why are they so useful?
Well, they provide really good stability, and they help keep that correct bite alignment while things are healing.
Okay. And then we have intraoral stabilization using wire. Sounds like there are a bunch of different wiring techniques.
Oh yeah, quite a few specific interdental wiring techniques are mentioned, things like the Ivy loop, Stout's multiple loop, Essig, Risdon wiring. These involve placing thin wires between specific teeth very strategically to give support. Dental wiring, sometimes called circumdental wiring, where you loop wire around individual teeth, is also common, often as an anchor point for those splints we just talked about.
Ah, okay.
And then there's osseous wiring. That means drilling tiny holes in the bone itself and passing wires directly through them. You can wrap wire around the bone that's circumferential, pass it through the bone transosseous, or do a combo.
Wow.
Essentially, with all these wiring methods, the goal is to create a stable framework to hold the broken pieces together while they knit.
It's amazing how many ways there are to use wire. What about more sort of traditional orthopedic hardware?
Yeah, internal fixation, using things like orthopedic wire, intramedullary pins.
Yeah.
Though the source gives a big warning not to put pins in the mandibular canal because of nerve damage risk.
Oh, right.
Small bone plates, screws, those can be used for most classes of fractures. But placing them needs really careful planning to avoid tooth roots and other important bits.
And external fixation.
Right, external fixation where pins go through the bone and connect to a bar or tube outside the mouth, often beefed up with composite or acrylic. That's another option for stabilizing many types of jaw fractures.
And finally, the source mentions salvage surgery. When does that come into play?
Salvage surgery is usually for those really severe Class J fractures or other cases where a stable repair just isn't really on the cards. This might mean a condylectomy, removing part of the jaw joint for irreparable TMJ fractures.
Okay.
Or maybe chyloplasty, which is a reconstructive procedure to help support the lower jaw sometimes. And in really tough situations, like extensive damage or a fracture that won't heal, removing part of the lower jaw, a partial mandibulectomy might be needed.
It sounds like choosing the right treatment is a really complex decision. The source also talks about key things to consider during the surgery itself.
Yes, definitely. From the get-go, you have to constantly think about the animal's bite, where the tooth roots are, the overall anatomy.
Right.
The source even suggests maybe placing a temporary feeding tube through the neck, a pharyngostomy tube, so you can actually check the bite during surgery without the breathing tube getting in the way.
Clever.
And for teeth, right in the fracture line.
Yeah.
The goal is usually to try and save them if possible, maybe with root canals. Taking them out can sometimes make the repair less stable. Bone grafting, using bone from the patient, a donor, or synthetic stuff, can also be used sometimes to help fill gaps and encourage healing.
And the source really seems to like those composite or acrylic splints when used with wiring, doesn't it?
It does seem to emphasize that combination, yeah. It often allows for a better restoration of the correct bite and can be maybe less traumatic to the teeth than some other methods. And of course, cleaning up any damaged soft tissue and closing wounds properly is crucial too.
The source then gives a pretty detailed guide on actually applying these splints. Sounds precise.
It is. It starts with meticulous cleaning, disinfecting, maybe polishing the teeth. Then the fracture is gently manipulated to get the bite right.
Okay.
To stop the bonding stuff sticking where you don't want it. Nearby teeth and gums usually get a coating of petroleum jelly. Then the enamel of the teeth getting the splint is etched with a mild acid, makes it rough for a better bond.
Right.
You apply a special bonding agent for composites. For acrylics, you mix the powder and liquid and apply it carefully in small bits to avoid too much heat, which could damage the tooth. Composites are generally pricier, but produce less heat and fumes.
And then finish it off.
Yeah, once it's hard, it's carefully shaped and smoothed down so it's not irritating.
Okay. And what about wiring those symphyseal separations at the front? Any specific advice there?
Yeah, that's a common fix for those midline splits.
Yeah.
It usually involves passing a wire around the bone, often using a fairly thick needle to make little entry points near the gums. Then a finer wire, or maybe even strong suture in tiny animals, is passed around the mandible, usually just behind the canine teeth, and tightened to pull the halves together.
But not too tight.
Exactly. Crucial warning. Don't over-tighten. That can pull the lower canine teeth inwards too much, creating what's called a base narrow bite where they might hit the roof of the mouth.
Ouch.
Yeah. The source even suggests a figure-8 wire pattern around the canines and under the jaw as a way to potentially correct that if it happens.
So accuracy and careful technique are just paramount. Okay, once the fracture's fixed, what's recovery like? Home care follow-up.
Home care is absolutely critical for success. Owners often need to apply orthodontic wax to wires if they're rubbing. Oral rinses are usually needed, maybe chlorhexidine to control bacteria, or zinc ascorbic acid solutions to help tissues heal a couple of times a day.
And food.
Soft or even liquid diet is typical during healing. Making sure they get enough calories and fluids is vital. And definitely no hard chew toys or anything requiring forceful chewing.
Makes sense. What about vet follow-ups? How's it monitored?
The source outlines a typical schedule, usually a physical check about 2 weeks post-op, then x-rays every 4 to 6 weeks initially, then maybe every 2 weeks until there's good evidence of bone healing.
Okay.
That's when you can think about removing any appliances. And it's worth noting there's a slightly higher risk of refracture for a week or two right after removal. Once the bone is stable, any damaged teeth might need further work, root canals or extractions. And if the bite isn't quite right after healing, sometimes orthodontics or selective extractions might be needed down the line.
So ongoing monitoring involves
Checking fracture stability, appliance stability, oral hygiene, making sure they're eating and drinking, watching their weight, looking for any signs of pain or swelling. It's pretty involved.
It certainly sounds like it. Is there anything that can be done to, prevent these injuries in the first place?
Well, the main thing is really trying to minimize the risk of trauma. Keeping pets in secure areas, especially if they're prone to wandering or fighting. Taking precautions against falls, things like that. Basic safety, really.
Unfortunately, accidents happen. So what are some potential complications or longer-term effects, even with good treatment?
Yeah, despite best efforts, things can still go wrong. A persistent bad bite, malocclusion is possible. Problems developing inside the teeth, needing root canals later. Bone infections, osteomyelitis. The fracture not healing, which is called non-union, maybe bits of dead bone forming. Sequestrum. The surgical wound breaking down. Dehiscence. Those are all risks.
And other things.
You can also see nerve damage causing facial pain, trouble chewing, maybe temporary weight loss, and irritation from the wires or splints themselves. Long-term, maybe chronic arthritis in the jaw joint, the TMJ. A persistent bad bite causing weird tooth wear. Non-union needing bigger surgery. Sometimes the jawbones can fuse together. Ankylosis. And chronic facial pain from nerve issues.
That is quite a list of potential downsides. So what's the overall outlook, the prognosis generally?
Generally, the prognosis is actually pretty good, but it really does depend on a lot of things. Any underlying health problems, how severe the initial injury was, the exact location and type of fracture, how well the owner manages the home care, and of course, the treatment choices made.
And healing time.
Our source suggests a general time frame of about 4 to 12 weeks for the bone itself to heal, for bony union.
Okay, so while they're definitely serious injuries, it sounds like with the right vet care and dedicated home care, Many animals can actually recover well and get back to a pretty normal life.
Absolutely. Yeah, it's really a testament to both the resilience of these animals and, the advances in veterinary surgery and techniques.
Well, this has truly been a deep dive into jaw fractures in animals.
Mm.
We've covered everything from those intricate classifications to the huge range of treatments and just how vital that aftercare is.
Mm.
The key takeaway for me seems to be just how complex these are, needing careful assessment and a really tailored plan to get that bite and function back.
Indeed. And that emphasis on restoring the occlusion, the bite, it really highlights how interconnected the whole oral system is. Bone, teeth, muscle, all working together.
Which, it makes you think, considering that intricate interplay here, what does that tell us about the delicate balance needed for overall health in animals or even in us? What other injuries that seem simple on the surface might have similarly complex things going on underneath?
That's a great point.
It definitely gives you a new appreciation for just, well, chewing. As always, we encourage you to check out veterinary resources and talk to your own vet if you have specific concerns about your pets. Thanks for joining us on this deep dive.